Good afternoon, and today I have a pleasure of interviewing Dr. Stasha Gominak. She is retired neurologist and a sleep coach. And thank you very much to our audience. If you have trouble sleeping or sleep next to a snoring partner, our program is going to be for you. We're going to talk about Stasha program RightSleep and about Stasha approach to treat sleep through treating microbiome. You know, I'm really passionate about that topic, treating microbiome or ecosystem of intestinal, of our intestine and stomach and mouth, all this tract, what help us to digest food, but in the same time, I have a lot of residents, little bugs, and to keep those bugs healthy, not pathological, that's what Stasha work devoted to. And if you're a medical professional who, just like us, trying to put together all the danger or puzzles of sleep apnea and the treatment, we're going to find a lot of answers to your questions with Stasha unusual approach, at least approach what make me say, wow. She is a retired neurologist. She was practicing neurology for many years. And then she started writing, and she, in her articles, she illuminate worsening of sleep in our society because of reduced sun exposure. And I'm one of those people who put together, sunblock mask all over my body. And yes, my vitamin D is very low. And then in 2016, she found the connection between this, GI ecosystem and poor sleep. And she started helping people to normalize the sleep by normalizing intestinal bacterial population. And she created a program called RightSleep. So today we're going to find out a lot of things about the program. And usually I start with my personal story, how why I decide to invite Stasha Gominak on my program, because I knew a lot about Stasha for many years. A lot of my colleagues practice or took the course of RightSleep or practice the way she taught them on a course and helping the patients with that program, like implementing that program into the practice. And then I thought, okay, she would be great for my audience to learn. So please tell me, Stasha, we're going to start from vitamin D. You know, that vitamin D, what we're all deficient because we're so scared about the sun exposure. How vitamin D reshape microbiome and how it's actually affect the sleep architecture.
Well, what I discovered was that vitamin D is one of the bacterial growth factors. That was not reported directly in humans using experiments until 2020. But that's something that made sense to me in a general way.
So you think our lack of vitamin D significantly change our ecosystem inside?
Yes. Maria, let me ask you this. I thought these were the reals.
This is it.
Okay. It's important coincidence is that because I and my colleagues were alive before we moved indoors, we had our education in medicine at a different time. And then as the 80s developed, so I went to medical school between 1979 and 1983. There are many things in medicine that first started to be reported in mid-1980s. And those of us who had training at that time often thought they were just not real diagnoses, including chronic fatigue, fibromyalgia, irritable bowel syndrome. Anything that has these funny names usually means we don't have an answer for why they happen. So there are all these unexplained things that are happening in otherwise normal young people. That's another thing. Children and young people being affected by things that weren't part of our life when we were young, before medical school and after. So there's a timing or a timeline that I've been looking at since the early 2000s. And then when I got into sleep, I realized that some of these things are connected to one another. Like, it's not uncommon for someone who has daily headache to then develop fibromyalgia and chronic fatigue. And because we don't have a good answer for them, I puzzled over them a long time. The second thing was that once I stumbled by accident into the fact that vitamin D has receptors in our sleep switches, it was obvious to me, because I was alive in the mid-'80s, that we did not have sunscreen before the mid-'80s, and we did not move inside in this huge amount all over the globe until the middle to late 80s, when computers, air conditioning became more common. And one of the really important things is, around the globe, if you become educated, you have the money and the luxury to go to college, you wind up in an inside job. You don't wind up digging in the dirt. Also, even the people who are very rural are now plowing their fields with tractors that are air conditioned. So even people that feel like they're outside people are not living outdoors to the extent that our populations did before. So when I fell into vitamin D, all of a sudden there were these two things that had the same timeline. So at that point, I started to think of it differently. What we had been trained before was all these things must be related to toxins in our food, toxins in our environment. Our food isn't as good. We don't do things right. Those are things that are not incorrect. They're just not the complete story. And the frustrating part for me and the patient is, I can't really intervene much in the toxins in my food. I can do diet, I can do exercise, but if those things haven't improved my sleep, and my sleep is still poor, what can I do as a clinician to intervene? And finding that there was a deficiency in something was so exciting.
So your idea was a deficiency of vitamin D.
Yes, but I found that accidentally. It wasn't that I went looking for it. It was that I spent 5 years giving CPAP devices to people who had sleep apnea and sleeping pills. And that's all we have. Okay. And we're going to talk about behavioral therapy for insomnia. I think that is helpful in some cases. And if that works for you, great. But already many of my patients, when they would come in, and again, I was not a sleep expert. I'm just a neurologist, a general neurologist, but I become interested in sleep. So I ask all my neurology patients, what is your sleep like? And then I learned that I often say it's fine because I don't know the other questions to ask. So then I start to ask deeper questions. And ultimately, many of the people who have problems that I'm seeing them for are young, healthy women in their 30s who've had a couple of kids. And what they say is, I wake up at 3 a.m. and I can't go back to sleep and I'm tired all the time. And pretty quickly, I realized these are women who would never have said that to me if I didn't really pepper them with questions. Because the answer for most of the people for the most clinicians is going to be, you have 2 little kids. What do you expect? We expect you to be tired, to be at the end of your rope because your children are not sleeping. But in the past, if women could have 15 babies and live through it, that means the children are supposed to be sleeping. That means the child and the mom potentially both have a sleep disorder. And if you do the sleep studies on the kids, they definitely have a sleep disorder as well. Over the last 40 years, we've forgotten what the normal sleep is for children. And in fact, we have very, very little information about what was normal sleep before the 1980s. Because we really didn't study kids. Most of the books are from people who are moms or nurse practitioners who are observational. That doesn't mean that they're not valuable. It just means we don't have the sleep studies and the digital information of what it was like in a population that was not D deficient and hadn't lost the microbiome. That means the new normal for everybody who's having kids is to be sleep deprived terribly. And 2 or 3 kids later, they get an autoimmune disease and they get other things that they really shouldn't be happening. Let me stop there and let you ask me any other questions.
I want to ask you about microbiome repair. Why restoring vitamin D deficiency requires specific growth factors rather than supplementation? Like, I want you to share with us what the correct regimen, like how, you know, if I'm going to take this, because my friend, very close friend, you know, very sharp, he's in his late 70s, super active. He take 60 supplements. When I look at the amount of pills he's taking, for me, like, my hair stands straight. But in the same time, you know, he has purpose, he's active, he's doing all of that. And I'm thinking, like, for modern person, 60 pills.
That's a beautiful start. First, let me say that I personally have been trained away from supplements because I'm an MD. And I think that is a tragedy, because all of these things are vital aspects of our biochemical pathways. All of them are. Now, the other important thing to know is all of the same chemicals that we are using are used by the bacteria. The bacteria are the first on this planet. They are here for billions of years, and they played a role in, for instance, being able to dissolve the rock they're sitting on, take in sulfur or sodium or iron, and use it in a biologic living creature. That means they started this whole miraculous event of living things. That means we have depended on them, who perfected many of the things we do. And as we then moved into version after version of multi-celled organisms, if you picture, for instance, 250 million years ago, the dinosaurs had the same kind of reliance on their microbiome that we do. Reptiles will have slightly different, but they would use D3. We know that because reptiles, birds, insects, mammals, all of us use D3. And we're going to talk a little bit more about what we use it for, but that D3 is a pivotal part of who lives inside us. D3 turns out to be one of the growth factors that selects for certain bacteria. Bacteria that don't like D3 don't grow inside us. And those that do like D3 do grow inside us. Now, that's only if we're living outdoors, because all of us started outdoors. Now, there are certain species like owls, for instance, who actually sleep during the day, and therefore they're not out in the sun as much. And they do have a different reliance on, for instance, they eat the whole mouse. So when they eat the whole mouse, they're absorbing the D3 from that mouse, from the mouse's liver. So you could theoretically go to your neighbor, kill your neighbor, eat his raw liver, and you would get D that way, okay? And the reason why I tell you that is because medicine has stuck in its head that D is a nutrient, and it is not. The reason why we know that is we have tried over the last 40 years to rely on food as a source, and we've all become deficient. And many, many of the diseases that we see that are chronic and common now are related to the D going low. So in the background, when we were existent outside, and every other animal on the planet that exists outside, the D that animal makes is usually made in their fur or on their feathers. And it's interesting that in the veterinarian literature, the veterinarians know that birds, when they're kept indoors, they will preen their feathers, and the D on their feathers goes to a preening gland, and that D plays a role in how cranky they are. So the vets tell you, if you have birds that are supposed to be outdoors, which all of them are, then you have to supplement their D or they'll peck each other to death. Now picture humans being put in jail for years at a time, or moving indoors and staying indoors. They get cranky and they get weird and they get lots of psychiatric illness. That means that some of the things about D are already known, but in an odd way in different places, not in medicine, okay? It was my supposition that the D was the only thing wrong with my patients who didn't sleep well, because they were otherwise healthy, because I fell into the literature of a guy named Walter Stumpf, who was very, very expert at finding where the vitamin D receptors were in the body. And very soon, in the early 1980s, he began to publish what he thought the purpose of vitamin D was. Because he showed that there were so many receptors in the GI tract, I thought when I started to give vitamin D to my patients that it would fix everything, including the irritable bowel syndrome, and it did not. And for 2 years, I gave D. I learned about dosing. It's very difficult. I saw everybody get a little bit better. Their sleep definitely got better. But the most important part is at 2 years, they started to have new symptoms. I started to have new symptoms, and they started to have new symptoms that were mostly painful, which is something that you can't really ignore as a clinician. So when they come in and say, you know, I've never had this before, but I have this burning in my hands and feet. It's very painful. It started within the last month. I want to know if it has anything to do with the vitamin D I've been taking for the last 2 years. And the weird thing is it takes 2 years before it appears. And I'm following about 500 to 1,000 people. The only thing they have in common is they're doing this vitamin D stuff with me. So I have people burning in their hands and feet. I have a second woman. Both of these women have just daily headache. That's it. They have nothing else wrong with them, no diabetes. And importantly, they were already on B12. B12 is something that's been written about fairly substantially for burning. So they were already on B12. So they weren't B12 deficient. And therefore, I had no answer for them. And 2 of my patients are terribly uncomfortable. And now I start to have more patients coming back saying, I have all this generalized joint pain. I'm only 35. I'm going to the rheumatologist. Does this have anything to do with the vitamin D I'm taking? And I was terrified, frankly, that it was related to the vitamin D, but I couldn't explain why. It's not a direct effect. Then by accident, not by accident, a patient brings me a book at a time when I'm desperate. So I will actually read a book because I want to help my patients and because I'm afraid and I have no answer. She brings me a book about pantothenic acid. And I, of course, look at it and go, eye roll, another person bringing me some crazy stuff about vitamins because I wasn't really focused on vitamins. But there's an aspect to this in the background, in the back of my head, which is I am not interested in people being asleep. I'm interested in them making repairs. We want to sleep so we feel better. If we feel better, it's because there are repairs being made. And I am convinced that there are certain phases of sleep you must get into. It's not okay to sleep for 10 hours and not feel good. Now, as we have more access to sleep studies, I did about 1,000 sleep studies at the beginning of this. Many of my patients who are young and otherwise healthy had no rapid eye movement sleep, reduced rapid eye movement sleep, or REM-related apnea. And that was absolutely not explained. I thought the D would improve it, and it clearly did. But I also thought, there's a possibility then that as I'm inducing a state where the brain is now making more repairs, which is what I want, and D is encouraging that, because we're encouraging more repairs, we're starting to go low in the building blocks. What are the building blocks of these repairs? The building blocks of every single repair are all the vitamins and minerals. It's true that we used proteins and we make amino acids and things like that. But the things that might have gone low are other things that like vitamins. So she gives me this book. She gives it to me because it's a book about pantothenic acid improving the pain of people with rheumatoid arthritis. And she brought it to me because the author says not only when I recommend this pantothenic acid, do they have less pain, but their sleep gets better. And for the first time, I now have something else other than B12 and D that's powerful in sleep. And that's what I've been looking for. Now, my first thought is, have I then forced someone into a B5 deficiency state by having them sleep better and repair? They're using more of it. And wait, we're taught that the Bs come from the food. If the bees come from the food, and none of my patients have changed their diet, and they're all well fed, and they're all on different diets, there's been no change in that. Why would making more repairs then lead them to become deficient in something that all of the literature says pantothenic acid deficiency doesn't exist because it's in every food? And that is a lie. It is a bald-faced lie. And I have the proof of that by this woman gives me this book. I look at the book and I say, well, I have this weird buttock pain that I can't explain. I can't sit down when I'm talking to my patients. At the end of the day, I have no answer for that. That's happened in the same time frame as my patients with the burning and with the terrible joint pain. I'm going to go buy this stuff and try it. Only because I'm desperate. Okay, I'm experimenting in my patients. I admit that. I am not a scientist, but we're all desperate because nobody has a better answer. Nobody has an answer for why all my patients have REM-related apnea, except to say, oh, we get very paralyzed in REM sleep. So I go and I buy pantothenic acid. And the first thing that happens is I buy the recommended dose in this book, because that's the recommended, and that's the only dose of pantothenic acid sitting on the shelf in the health food store. And then I think, I remember from medical school that if you give one B vitamin, you should give all of them. And I just pops into my head. And so I look at all the B complexes, and the B complexes are a terrible mess, because if it says B complex on the front, you have no idea what's in it. You can look at the back and it can be anything from 2 Bs to 8 Bs. And frankly, at the time, I didn't even know how many Bs there were because I wasn't that interested. I had been interested in vitamins before I went to medical school, and I read a lot about them, but I had been trained away from them. And in fact, in the 1980s, medicine started to say, if you have a good diet, you don't need vitamins, which might have been true in the 1970s and the years before, because if we have a normal microbiome, they provide the Bs. Okay. Now, the second thing that happened was I went home with this thing called B100, which is a large dose B complex that, because it says B100 on the front, it almost always guarantees you that it will have 100 milligrams of thiamine, 100 milligrams of riboflavin. It establishes the dose ratios of these 8 chemicals. Because I had been so frightened by the vitamin D, it was very difficult to get that right. I was very worried about the dosing of these Bs because I really didn't know anything about them. And I'm, as I said, experimenting. So I go home myself and I take 400 milligrams of pantothenic acid and B100. My sleep did not go bad, but my restless legs, which is my personal sleep disorder, got very bad within 2 or 3 days. Unfortunately, I didn't notice it until about Thursday or Friday. And in the meantime, I've given the recommendation of 400 milligrams of pantothenic acid and B100 to about 30 to 40 of my patients, all the ones that had a sleep study with me, didn't have better sleep now because their sleep had been better with D, but now it's worse again. And now they have pain that's unanswered, the 2 gals with the burning included. And unfortunately, by Friday, I realized that this is probably a dose problem because my restless legs was terrible by Friday. And so I stopped the 400 milligrams of pantothenic acid and I stay on the B100. So now what I've done is I was on 500 milligrams of pantothenic acid. Now I'm on 100 in the B100. And in a day, my butt pain goes away and my sleep is better and I feel great. And I think they already think I'm crazy. My colleagues are lots of eye rolls from my colleagues. So I'm not going to tell them about this, but this is really weird because whatever it is we're doing with this vitamin, it's acting like Adderall. It's acting like an amphetamine. It is changing the sleep and it's changing something that I'm very interested in, restless leg syndrome. It's acting like a neurotransmitter. As soon as you take it, something's different. And if you get the dose exactly right, then your sleep is great. So then my patients start to come back in, and 30 out of the 40 people that I told about this were very unhappy with me. And they said, this 400 milligrams made me very agitated. I couldn't really calm down and I couldn't sleep at all. So I only took it for 2 days. Now that means the woman who wrote that book found that her patients or her clients got better on 400 milligrams, but mine did not. It was the opposite. Now that means every chemical that has power in sleep, theoretically, if it makes you not able to sleep, it still means it's got power. It just means that the dose isn't right. And that's true of D as well. And it's true of B12 as well. So then I think, well, why would all of my patients require a lower dose? Because several of them said the same thing, did the same thing that I did. They stopped the 400 milligrams. They went on the B100 by itself. And they said, you know what? As soon as I stopped that 400 milligrams, all my pain went away. Now, there are two aspects to that. One, if the dose is too big, your pain can be terrible. That's a very weird idea, but that's exactly what I had seen with D. D is a hormone. We think of it like thyroid. That means when it's too low, it doesn't feel good. When it's too high, it doesn't feel good. That is not the way we've seen vitamins, but that is actually what your body is telling you. The same thing can happen when it's too low and too high, which is a very weird concept, and it would not have occurred to me except that I had had that experience so much with D. Now, the next thing that happened was I got my patient now on D plus 100 milligrams of all the Bs. And I start to read about the B vitamins. The literature at that time was not brave enough to say, you know, maybe you haven't thought about this before, but there's an A vitamin and then 8 things called B and then C and D. Like, why would there be 8 things called B? It took me 5 years before I really thought about that. But the literature was saying, gee, thiamine has a poop bacteria source and a food source. Riboflavin, all 8 of them have a poop bacteria source and a food source. And I think, well, I never took any vitamins. How come I'm okay? What if they're all coming from the poop? What if they've always come from the poop? Well, why then would my patients need more than what comes from the poop? My patients have irritable bowel syndrome. And my patients, some of them are obese, and they didn't lose weight with D. That was really important. One, the IBS was still there. So the D did not correct the microbiome. And so I'm thinking, what do those little...
That's also fascinating. So the right balance of the vitamins is so important, not only for the sleep and for ecosystem in the gut, but also, you know, preventing the type of, you know, restless leg and all of that. And it has to be calibrated so meticulously. So I recommend to my audience to visit Stasha's website and take her course, RightSleep, if you have problems sleeping, and learn everything from Stasha. And of course, it's all personalized and it has to be done exactly right. Thank you very much. And Stasha also have her own YouTube channel where you can learn. And I highly
have a workbook.
And a workbook, what we see behind, also for great sleep, what you can really design your individualized way to sleep, right? So thank you very much, Stasha, and we appreciate you sharing your vast knowledge with us.